Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and hi everyone. Welcome back to the OPT 501 Ocular Pharmacology. For this week, we will gonna learn about topical ocular anesthetic. Let's look up what is a local anesthetic. Local anesthetic is a medication that causes absence of pain sensations. Local anesthetic are drugs that produce reversible conduction blockage of nerve impulse. Increasing the concentration of local anesthetic will cause a blockage of the autonomic system, followed by sensory anesthesia and skeletal muscle paralysis. These effects are completely reversible and do not cause any structural damage to the nerve fibers. Topical applications represent the most common route of administration of local anesthetic for procedures involving the eye, such as cataract surgery, intraocular implantation, phacoemulsifications, and others. Another good thing is the local anesthetic can cause loss of sensations without cause loss of consciousness, which are highly useful for many of its procedures and eye surgery. Besides that, it will prevent systemic complications such as post-operative confusions, nausea and vomiting, urinary retention, and stress response to cardiac patient. However, local anesthetic quite painful after a certain limited of time. Besides that, it's also difficult in uncooperative patients. These local anesthetics are not suitable for young patients, mentally unstable patients, and patients with physical disability. Let's learn about the structure of the local anesthetic. Topical local anesthetic structures components consist of three parts, which are an aromatic hydrophobic portion, intermediate linkage that consists either ester or amide, and terminal amide. Most of the commonly prescribed topical local anesthetic structures, such as tetracycline, proparacycline, and benzoate, have ester linkage as the circle red diagram, while lidocaine, the only topical local anesthetic that has amide linkage structure. All the topical local anesthetic structure has the amphiphilic property of the drugs due to the structural components consist of an aromatic hydrophobic portion and a hydrophilic amine. These amphiphilic structures are important, as we discussed in our first lecture, to ensure the optimum drug permission to the targeted site of action. Most of the local anesthetic present as uncharged amine or positively charged substitute ammonium cation. All these local anesthetics are formulated in solution as hydrochloride salts due to amine structure that is slightly soluble in water. These hydrochloride salt formulations enhance water solubility and stability in solutions and prolongs their shelf life. The non-ionized form of the amine structure give advantage on the easily crosses cell membranes, which are the key point in the distribution of the anesthetic to its site of actions. Local anesthetic are weak base with a pKa between 8 to 9. They tend to ionize in acidic solutions. However, the presence of tears, which in neutral or alkaline environment can cause the uncharged fraction of the drug molecule increases, which allows more anesthetic to enter the nerve cell membrane. Thus, the pH of the medium may alter how much anesthetic reach the site of action. The hydrophobic of aromatic ring plays an important role in determining the anesthetic activity and potency of the drugs. The greater the hydrophobicity, which can be translated by looking the chain structure of the aromatic ring of the local anesthetic, the greater the affinity for binding. Next, we will discuss about the mechanism of action of the drugs once they reach to the site of action. Once the local anesthetics reach to this site of actions, these drugs will stabilize the neuronal membrane by binding to heterotrimetic protein specific site that located within voltage gate sodium channel. This voltage gate sodium channel can be found in the cell membrane. This binding will inhibit the voltage gate sodium channels by limiting the sodium ion permeability through the lipid layer of the nerve cell membrane. This inhibition of the sodium ion influx prevents both generation and conduction of nerve impulses by blocking the initiation and conduction of impulse within the neuronal cells. This will result in a loss of sensation and skeletal muscle paralysis. However, these effects are completely reversible and do not cause any structural damage to the nerve fibers. Now, we will focus on the most common drug prescribed for topical local anesthetic. As I mentioned before, proparacaine, tetracaine, binozinate, and lidocaine are the most common drugs for ocular local anesthetic. Let's start with tetracaine hydrochloride. Tetracaine is an ester of para-aminobenzoic acid or well known as PABA. This tetracaine has been widely used for topical anesthetic of the eye. It is currently available in a 0.5% solutions. The onset, intensity, and duration of anesthesia are comparable with those of proparacaine and binozinate. Onset of 0.5% tetracaine anesthetic is sufficient to permit tonometry or other minor procedures involving the superficial cornea and conjunctiva within 10 to 20 seconds and can be last up to 20 minutes. The 1% tetracaine solutions produce anesthetic lasting nearly an hour and is used successfully to provide anesthesia during phacoemulsification cataract surgery and intraocular lens implantation. However, dangerous overdoses may occur if it is administered in doses higher than 1.5 mg per kilogram of body weight. Binozinate is commercially available only in combination with a vital dye solution. It is most commonly combined with a sodium fluorescein 0.25%, but recently it was combined with 0.35% disodium fluorescent, as in the picture attached here. Fluorescent is a high molecular weight fluorescein that does not stain hydrogel contact lens. Therefore, the use of fluorasafe is intended to allow contact lens patients to resume wear sooner without concern of contact lens staining. Binozinate is available only in combination with a vital dye, so that its primary clinical use is for applanation tonometry. Fluorescein solution serve as a good culture media for Pseudomonas aeruginosa. That is why the combination with binozinate, or also known as binozinate sodium fluorescein, has been shown to have substantial bactericidal properties. Proparacaine is commercially available in a 0.5% solution both with and without sodium fluorescein 0.25%. Proparacaine alone, or other words, without the sodium fluorescein in the formulation, it is widely used as a general-purpose topical anesthetics. Patients more prefer to use proparacaine compared to tetracaine due to produce little or no discomfort or no irritation during the instillations. Most of the patients justify that proparacaine can cause less pain during the administration. 3.5% lidocaine hydrochloride was commonly used for topical anesthesia. One drop of 3.5 lidocaine solution renders the cornea anesthetized within 30 to 60 seconds and effect can last for 10 minutes. It is rapidly acting and does not cause dilation of pupil. On topical installation, however, it causes marked stinging sensation for 30 seconds. Due to its stinging sensation problem, it is now less commonly used for topical anesthesia purpose. Safe dose of lidocaine is 2.9 mg per kilogram of body weight. This is the last part of this week's lecture, which is the evaluation of topical ocular local anesthesia. When applied topically to the eye, the anesthetic in current clinical use have relatively low systemic manifestation such as allergic hypersensitivity reaction and rare of ocular toxicity. As long as the use in recommended dosage, the side effects are rare. Usually, the majority of such systemic reactions occur as a result of overdosage of the drugs, such as mild stinging and burning sensation, shortening of tear breakup time, decreased the blinking, corneal edema, and decreased epithelial mitosis and migration, etc. Topical ocular local anesthesia agents are useful and preferred for ocular diagnostic and surgical treatment due to sufficiently optimal duration of action, low cost, stability in solution, and general lack of interference with action of the other drugs. Because of that, these agents make them useful for such ocular procedures. That's all for this week's lecture. If you have any inquiries, please do not hesitate to comment or ask me. Thank you everyone. Stay safe and have a nice day. Thank you. Assalamualaikum warahmatullahi wabarakatuh.